there, this is Andrew Gorecki, and I wanted to reach out to all of the past patients from Superior Physical Therapy this month and give you more valuable information on certain conditions so that you are able to help treat and prevent these things from happening on your own. So this month we're talking about two foot conditions that we see very commonly. The first foot condition is plantar fasciitis, and the second condition is Achilles tendonitis. Those are by far the two most common reasons people have foot pain. And I just wanted to take a minute in this video, in this email, to describe the problem that's out there. And then in the next email I send you, I'm going to talk about some of the common treatments that are done and how they're maybe not the most effective. And then in the third and final email this month, I'm going to give you 3 strategies on how to help relieve plantar fasciitis and Achilles tendonitis. So let's first talk about plantar fasciitis. So we're going to use our handy dandy Essential Anatomy 3D app that we have here, which is pretty cool. And we're going to focus on the right foot. So I'm going to add the connective tissue of the foot, and you can see that if you look at the foot, the bottom of the foot, this connective tissue right here is called the plantar fascia. And its job is really to hold together and give the arch of the foot integrity. If you can see on top of the foot, we have a lot of bones. In fact, if I take the tissue away, you can see that we have actually 33 joints. And so those joints are held together by connective tissue as well as muscles. And a very, very strong connective tissue is the plantar fascia. And when somebody gets plantar fasciitis, or anything in the body that's called with an itis, ends with an itis, means inflammation. And so these structures on the bottom of the foot start to get stressed out. And the stress causes little micro tears in this tissue. And when these micro tears happen, the body feels as though it needs to heal those micro tears. And we know that the first phase of healing is inflammation. Normal 7 to 21 days of inflammation that occurs in the healing process. And so when somebody has plantar fasciitis, commonly what you'll hear them complain of is, I have pain when I stand or walk. And usually this pain is worse in the morning. And the reason it's worse in the morning is because at nighttime our body's trying to heal. And so the body's laying down these building blocks to heal the torn tissues. And then as soon as you take the first step, the body then, or the tissue gets stressed and those micro tears reopen. So definitely common when somebody walks or stands, they have bottom of the arch pain. And that is this connective tissue right here. It's also common to have pain with walking and running. And I've also experienced this personally in the past. And I know that I had this pain that was worse after I sat in a chair for a long time. And we can talk about that. I believe we'll talk about that in video 3. The second condition we want to cover today is called the Achilles tendonitis. And we're going to add some musculature here, and we're going to look at the back of the foot and ankle. And you can see right there when I add this layer, there's this big tendon that goes down. And what it is that basically it is the calf. If I zoom out, you can see this big calf muscle that comes down. It's called the gastrocnemius. And that muscle goes down and it turns into a big tendon. In fact, it's the biggest tendon in the body, the Achilles tendon. And we've got that highlighted right here. And the Achilles tendon is responsible for a lot of things, but ultimately the Achilles tendon is responsible for decelerating when the foot hits the ground, the forces that the body has to decelerate. So when the foot hits the ground, there's a response from ground reaction forces. It pushes force through the foot all the way up the leg, and the Achilles tendon is responsible for absorbing and transmitting that force. And when somebody gets Achilles tendonitis, here we go, this is really going to give us, what you saw there was a muscle layer. This is called the soleus. That's part of the Achilles tendon. And then when you add on the bigger muscle, the gastroc, that's the rest of the Achilles tendon. And so you can kind of see that if we isolate that, that's a big tendon. And when it gets inflamed, or I guess again, we go back to the micro tear concept. When this tendon gets overloaded with stress and it can't handle the stress, it begins to micro tear. When it micro tears, the body then sends inflammation to begin to heal that area. And then, of course, you get pain. And most commonly with someone with Achilles tendonitis, has pain again with standing and walking. And it can be very debilitating, and it can really inhibit our ability to exercise and to move around in our day. Very common, and hopefully that helps us understand what the problems are in the foot and ankle most commonly that we see. And then look for an email here in the next few days. Video number 2 is going to talk about the 2 most common treatments that are out there for these 2 conditions, and how, even though they're the most common treatments, research shows they're not effective, and we're going to talk about why. And then again, in the final video, I'm going to give you 3 strategies on how to treat this yourself. I do want to mention that in the month of this month, we are offering 10 free screens to anybody that has Achilles tendonitis or plantar fasciitis or any foot pain. And that includes you as a past patient of Superior Physical Therapy, or anybody that you know. So we have 10 spots available. I know 4 have been taken already. And we hope that if you're having any issues, you'll raise your hand and either email me directly just by replying to this email, or give our front office a call at 231-944-6541. And I hope you're doing well.